7 walking mistakes that are destroying your health after 50. It is a common sight, and perhaps even a familiar feeling for many, to walk into a doctor's office brimming with the conviction that one is doing everything right, particularly when it comes to maintaining health through consistent physical activity. Individuals, often in their later years, meticulously adhere to a routine of walking, dedicating 30 minutes or even more to this seemingly beneficial endeavor each day. Yet, despite this diligent effort, they find themselves grappling with an array of debilitating issues: persistent knee pain that radiates with every step, an overwhelming sense of chronic fatigue that saps their energy, an unsettling numbness that creeps into their legs, and an overarching sensation of their health deteriorating rather than improving. The initial question posed by a discerning physician in such scenarios is invariably the same: how exactly are you walking? This seemingly simple inquiry often unlocks a cascade of revelations, as the crux of the problem rarely lies in the quantity of walking, but rather in the quality, or rather, the incorrect execution of it. Wrongful walking is far from being merely a wasted effort. It is an insidious force that actively contributes to the destruction of our joints, wreaks havoc on our posture, places an undue burden on our cardiovascular systems, and perpetuates chronic inflammation throughout our tissues. Over 15 years of dedicated practice, this pattern has become a recurring tableau, a consistent diagnostic picture painted by patients who, despite their best intentions, are inadvertently harming themselves through their walking habits. The current medical system, regrettably, often profits more from managing illness than from fostering genuine well-being. It is precisely for this reason that understanding the nuances of everyday activities like walking becomes so critical, especially as we navigate the changes that accompany aging. The information shared here is not typically disseminated during a standard medical appointment, but it is vital for informed health management. The goal is to empower individuals to take control of their health rather than remaining dependent on treatments for conditions that could, in many cases, be prevented or mitigated through simple, correct practices. This message is crucial for Dr. Watling's mission to reach 100,000 subscribers, as each individual who gains this knowledge contributes to a broader movement of proactive health. The foundation of our discussion lies in understanding why walking, especially after the age of 50, transcends being a mere pleasant pastime and transforms into a genuine medical necessity. This is due to a predictable and measurable cascade of physiological changes that begin to unfold within the body as it matures. Ignoring these fundamental shifts is no longer an option for maintaining optimal health. The first significant alteration is the gradual loss of muscle mass, a process scientifically known as sarcopenia. This age-related decline is characterized by a gradual deterioration of muscle tissue. After 50, individuals can expect to lose approximately 1 to 2% of their total muscle mass annually. While this percentage might appear modest on an annual basis, over a decade, it translates to a substantial loss of 15 to 20% of total muscle. Muscle, however, is far more than just a source of strength. It plays a pivotal role in stabilizing our joints, regulating our blood sugar levels, by controlling the amount of glucose circulating in our bloodstream, maintaining an upright posture, and providing the crucial balance needed for effective and safe walking. When muscle mass diminishes significantly, the entire intricate system that relies on it begins to falter and break down. Accompanying the loss of muscle mass is a stiffening of the joints, a phenomenon that directly impacts the cartilage responsible for cushioning our bones. Unlike muscle or bone, cartilage lacks its own direct blood supply, deriving its essential nutrition exclusively through movement. The mechanical loading and subsequent movement of a joint facilitate the circulation of synovial fluid, the lubricating substance within the joint capsule. This fluid is instrumental in delivering the vital nutrients that cartilage requires to remain healthy and resilient. In the absence of regular dynamic movement, cartilage effectively begins to starve, leading to a thinning of its structure, a loss of its inherent elasticity, and ultimately its breakdown. This degenerative process is commonly identified as osteoarthritis, and while it can be an outcome of aging, it is not an inevitable consequence. However, engaging in incorrect habits can significantly accelerate its onset and progression. The third physiological change is a noticeable slowdown in our metabolism. Our basal metabolic rate, which represents the number of calories our body expends simply to sustain itself at rest, typically decreases by about 2 to 3% every 10 years after the age of 50. This means that an identical lifestyle that maintained a stable weight in one's 30s will likely lead to weight gain in one's mid-50s, not due to any intentional change in habits, but because the body's internal engine has fundamentally altered. Concurrently, our circulation begins to function with less efficiency. The walls of our blood vessels gradually lose their elasticity, and the pumping power of our heart may slightly diminish. Peripheral circulation, which refers to the blood flow to extremities like the legs and feet, can deteriorate. This reduced efficiency is the underlying reason why many individuals over 50 experience persistently cold feet, disruptive nighttime leg cramps, and a heavy, tired sensation in their lower legs as the day progresses. Herein lies the critical connection. Walking, when performed correctly, acts as a powerful stimulus that positively impacts all four of these age-related systems simultaneously. It actively engages and strengthens muscles. It stimulates cartilage nutrition through the movement it provides. It helps to accelerate our metabolism, and it significantly improves our circulation. Numerous scientific studies corroborate these benefits, demonstrating that individuals who engage in regular walking exhibit significantly lower incidences of cardiovascular disease, type 2 diabetes, a condition where the body struggles to manage blood sugar levels effectively, osteoporosis, characterized by thinning of the bones, and cognitive decline. However, there exists a crucial caveat, one that is often overlooked or unaddressed. All of these profound benefits are contingent upon walking correctly. When the wrong walking techniques are employed, the outcome is not merely a diminished benefit. Instead, it results in the exacerbation of existing issues and the creation of new problems on top of the old ones. Therefore, a meticulous examination of the most common walking mistakes is imperative for anyone seeking to harness the true potential of this accessible form of exercise. Let us begin by dissecting the first prevalent error, starting your walk too quickly. This is arguably the single most widespread mistake observed across all age demographics and fitness levels. Individuals step out of their homes and immediately launch into a brisk pace, assuming that maximizing their walking time by foregoing a warm-up is a logical and efficient approach. However, the human body is not a mechanical device like a car, which can be instantly propelled to full operational capacity. The body requires a gradual transition from a state of rest to a state of active movement, a transition that, when skipped, carries significant physiological consequences. When you initiate your walk at a high intensity, your muscles are still cold. Colder muscle fibers are inherently less elastic, and this reduced elasticity dramatically increases the risk of micro tears, tiny microscopic rips within the muscle tissue. Individually, these tears may not produce noticeable symptoms, but their accumulation over time can lead to chronic pain syndromes. Furthermore, when you start too fast, your joints are not yet adequately lubricated. The synovial fluid, the protective lubricant within your joints, tends to pool in specific areas of the joint cavity while you are at rest, to effectively spread across the entire joint surface and create a protective film between the delicate cartilage surfaces. This fluid requires a few minutes of slow, deliberate movement to distribute evenly. Commencing your walk at a rapid pace means your cartilage is essentially attempting to function without sufficient lubrication. Moreover, your cardiovascular system is ill-prepared for such an abrupt demand. The heart does not respond favorably to sudden, intense increases in workload. When the intensity rises too rapidly, your heart rate spikes disproportionately, and your blood pressure surges more sharply than is necessary or healthy. This is particularly detrimental after the age of 50, when blood vessels are already less elastic, and such sudden spikes can impose undue stress on their walls. The solution to this pervasive mistake is surprisingly simple and requires no additional time commitment. Dedicate the initial 3 to 5 minutes of every single walk to moving at a deliberately slow, almost leisurely pace. This period serves as your warm-up, and it is not an optional indulgence reserved for elite athletes. It is a fundamental requirement for anyone who wishes to walk without experiencing pain. Following these initial 5 minutes of gentle movement, your joints will be sufficiently lubricated, your muscles will have begun to warm up, and your heart will have settled into a steady, working rhythm, at which point you can then comfortably increase your pace. The second common pitfall involves adopting the wrong posture while walking. Take a moment to observe people as they walk in your everyday environment. You will likely notice a preponderance of individuals hunched forward, with their heads jutting out in front of their shoulders, which are themselves rounded downwards and forwards, their gaze fixed on the ground a few feet ahead. This posture is not merely aesthetically unappealing. It represents a significant biomechanical catastrophe for both the spine and the respiratory system. To understand the mechanics involved, consider that an adult human head weighs approximately 11 pounds. When this head sits directly above the spine in a neutral, upright position, the muscles of the neck bear precisely this load. However, when the head shifts forward by just 1 to 1.5 inches, the load on the cervical spine, the neck portion of your backbone, effectively triples. If the forward shift extends to 2 inches, the load multiplies by an astonishing 4 to 5 times. This means that instead of supporting 11 pounds, your neck and upper back muscles are now continuously contending with 45 to 55 pounds. To walk for 20 or 30 minutes in this compromised position is to generate chronic muscle tension in the neck, shoulders, and at the base of the skull. This is the primary reason why so many individuals experience neck pain after their walks, not due to drafts or simply old age, but as a direct consequence of poor posture. The detrimental impact extends to the lungs as well. When the chest is compressed and the shoulders are rolled forward, the diaphragm, the primary muscle responsible for breathing, a dome-shaped muscle situated beneath the lungs, is prevented from descending fully. Consequently, the lungs are unable to expand to their complete capacity. This results in shallow breathing, utilizing only the upper portions of the chest and leading to the body receiving less oxygen than it requires. Insufficient oxygen directly translates to reduced energy availability for both your muscles and your brain, making a 30-minute walk feel as arduous as an hour-long exertion. Many people attribute this fatigue to age or a lack of physical fitness, when in reality, the true culprit is often their walking posture. There is a third, often overlooked, consequence of bad walking posture. It disrupts the entire biomechanical chain of the body. With the head forward, the lower back is forced to compensate with an exaggerated arch, the pelvis tilts, and the knees begin to operate at an incorrect angle. This misaligned loading pattern significantly increases the stress on the knee and hip joints, not because of age, but due to a single correctable mechanical error. The remedy for this pervasive postural issue is to cultivate a mental image. Imagine a fine thread attached to the very crown of your head, gently pulling you upward. This visualization does not imply forcing yourself into an unnatural, rigid stance. Rather, it encourages allowing your spine to decompress and straighten naturally. Your shoulders should be relaxed, drawn slightly back to their natural anatomical position, not in a militaristic, stiff posture. Your eyes should be directed forward, towards the horizon, rather than down at the pavement, and your chin should remain parallel to the ground, allowing your chest to remain open. In this corrected posture, your lungs are able to function at their full capacity, your neck is free from excess strain, and your spine effectively distributes weight in the manner for which it was designed. Mistake number 3, and a factor to which people often pay the least attention, is wearing the wrong shoes. Footwear is frequently an afterthought when planning a walk or determining its duration, a serious oversight because, for the health of your joints, the interface between your foot and the ground is of paramount importance. Two critical changes occur with age that make the selection of appropriate footwear exceptionally vital. Firstly, the natural fat pads on the soles of our feet, which act as indigenous shock absorbers, begin to thin out. These pads once effectively cushioned the impact of each heel strike on the ground. With their diminished thickness, this natural cushioning is significantly reduced, necessitating that your shoes compensate for this loss. If your footwear fails to provide adequate shock absorption, every impact from the ground is transmitted directly up the kinetic chain, affecting your ankles, knees, hips, and lower back. Secondly, the muscles and ligaments that support the foot gradually weaken with age, leading to the potential collapse of the foot's arch, a condition known as acquired flat foot. A collapsed arch alters the entire load-bearing angle of the knee, shifts the axis of the hip joint, and increases stress on the spine. The ideal walking shoe possesses several key attributes. Firstly, it must offer adequate cushioning in both the heel and the forefoot. The sole should be soft enough to absorb impact effectively, but not so yielding that your foot sinks without proper support. Secondly, it requires arch support. This does not equate to a rigid insole. Rather, it means that the internal shape of the sole should conform to the natural anatomy of your foot, preventing the arch from collapsing inward. Thirdly, the front portion of the sole should be flexible. During walking, your foot naturally bends at the ball, the widest part of the front of the foot. If the entire sole is inflexible, it obstructs this natural heel-to-toe rolling motion, placing excessive strain on the calf muscles and the Achilles tendon. An additional consideration regarding shoes is their wear and tear. Many individuals continue to walk in sneakers or athletic shoes purchased 2 or 3 years prior. While the exterior may appear perfectly fine, the cushioning materials within the midsole, the layer situated between the outer rubber sole and the inner lining, lose their shock-absorbing capabilities long before the shoe exhibits visible signs of wear. For those who walk regularly, replacing walking shoes approximately once a year is not a commercial enticement, but rather a proactive measure for osteoarthritis prevention. Mistake number 4 is a pattern of walking infrequently, but for extended distances when you do. This is an exceptionally common scenario for many people. Busy weekdays often lead individuals to confine their physical activity to a single, long walk on the weekend, an outing that can easily last an hour or even 2. They return home feeling fatigued, albeit with a sense of accomplishment, believing they have fulfilled their weekly fitness obligation. From a physiological perspective, however, this approach is fundamentally flawed. The human body does not respond optimally to isolated bursts of intense activity. Instead, it thrives on consistent, repeated stimuli. Each time you walk, your body receives a clear message. Physical activity is a regular part of your life. In response to this recurring signal, your heart gradually becomes more efficient, your blood vessels adapt to the demands, your muscles strengthen, and your metabolism remains actively engaged. This process, known as training adaptation, is solely dependent on the repetition of these signals. A single walk per week provides too weak a signal for the body to initiate meaningful adaptation. Therefore, the benefits remain minimal. Worse still, a solitary, lengthy walk undertaken after several days of complete inactivity represents a significant stress event for unprepared muscles. These muscles are cold, unadapted, and consequently are prone to soreness on the following day. This often leads individuals to draw an incorrect conclusion. Walking is not for me, my joints are weak. In reality, their joints are likely functioning adequately. The problem lies with the flawed loading pattern. Evidence-based medicine unequivocally supports a consistent approach. 20 to 30 minutes of walking on most days of the week constitutes the minimum effective dose for cardiovascular health. This is the regimen that demonstrably reduces the risk of heart attack, stroke, and type 2 diabetes. Not a single prolonged Sunday walk, but rather 5 to 6 shorter walks dispersed throughout the week. Your body adapts to what is repeated and only to what is repeated. If your current habit involves walking once a week, a strategic starting point would be to aim for 3 times a week, not necessarily 30 minutes for each session. Begin with 10 minutes, and after 2 weeks, gradually increase this duration by an additional 5 minutes. This approach of gradual progression is not a sign of weakness, but rather a testament to intelligent strategy. The fifth mistake, often overlooked, is allowing your arms to remain motionless while you walk. The majority of individuals either hold their arms rigidly at their sides, let them dangle limply, or most commonly, shove them into their pockets. While this might feel comfortable, it inadvertently strips away a significant portion of walking's inherent benefits and disrupts fundamental movement mechanics. Walking, it must be understood, is not solely a leg-centric activity. It is a whole-body, cross-pattern movement. As your left leg strides forward, your right arm should naturally swing forward in opposition, and vice versa. This coordinated movement, known as cross-coordination, is deeply ingrained in our nervous system. It serves to distribute the load symmetrically across the spine and significantly reduces the sideways torsional forces on the trunk with each step. When your arms are held static, your spine is compelled to compensate for this asymmetry by over-rotating in the lower back region. For individuals already experiencing lower back issues, this compensatory action can trigger pain. Secondly, the natural swing of the arms actively recruits the muscles of the shoulders, chest, and upper back. This means that during a walk with proper arm movement, a significantly greater amount of total muscle mass is engaged compared to a walk with static arms. More active muscle mass directly translates to a higher caloric expenditure, improved circulation, and a more robust metabolic response. The identical distance covered with proper arm swing delivers a more potent physiological benefit. Thirdly, arm movement plays a crucial role in establishing rhythm and enhancing coordination. This becomes particularly important after the age of 50, as coordination gradually begins to decline. A steady, rhythmic arm swing helps to maintain a consistent stride length and significantly reduces the risk of losing balance. To achieve this correctly, gently bend your elbows to approximately a 90-degree angle and allow them to swing forward and backward in a natural rhythm, opposite to the movement of your legs. There is no need for the exaggerated pumping action seen in competitive race walkers. The objective is simply to cease immobilizing your arms against your body. After a few walks, you will likely notice a tangible difference, with your walk becoming easier and more rhythmic almost immediately. Mistake number 6, a relatively recent phenomenon that has become a widespread concern, is walking while engrossed in your phone. 20 years ago, this particular mistake did not exist. Today, however, it is one of the most prevalent behaviors observed. Individuals walk while staring at a screen, reading messages, or scrolling through social media feeds under the misguided belief that they are actively engaging in health-promoting behavior. This is fundamentally incorrect. Let us begin by revisiting the impact on posture. When you look at a phone held in front of you, or worse, down by your waist, your head inevitably tilts downward. As we have already established, this forward head posture dramatically increases the load on your cervical spine, multiplying the strain on your neck muscles by 3 to 5 times. Your shoulders round forward, your chest compresses, and your breathing becomes shallow. All the detrimental effects associated with poor posture are exacerbated and actively reinforced when this is combined with phone use, as the head is angled even lower than during casual slouching. Now, let us consider the critical aspect of safety. After the age of 50, the vestibular system, located in the inner ear and responsible for balance and spatial orientation, begins to function with slightly reduced precision. Proprioception, your body's inherent sense of its own position and movement in space, also tends to fade. This is a normal and gradual aspect of aging. Consequently, your brain increasingly relies on visual input to maintain balance while walking. When your eyes are diverted to a screen rather than focused on the path ahead, your your brain is deprived of its most vital source of spatial information. You become less aware of uneven pavement, curbs, steps, wet surfaces, or sudden drops in the terrain. This significantly elevates the risk of a fall. A fall after 50 is far from a minor incident. It frequently results in a fractured wrist, fractured ribs, or, most seriously, a hip fracture. A hip fracture in an individual over 60 often necessitates extended immobilization, surgery, and a prolonged period of rehabilitation. The prevention for this cascade of potential harm is remarkably straightforward. Simply place your phone in your pocket. Furthermore, an essential final argument emphasizes that walking is not solely a physical exercise, but also a neurological one. When you walk while actively paying attention to your surroundings, the sensations within your body, your breathing pattern, and the environment around you, you are actively training your attention, coordination, and spatial awareness. This provides genuine, documented cognitive benefits for your brain. In contrast, when you are engrossed in your phone, this crucial neurological benefit is entirely lost. Your legs may be moving, but your brain is disengaged from the activity itself, rendering the walk less effective on multiple levels. Let your walk be a dedicated walk. Mistake number 7 is the pervasive neglect of recovery after walking. This is a topic that is rarely discussed, neither in clinical settings nor within fitness centers. The prevailing assumption is that walking is such a low-impact activity that no post-exercise recovery is necessary. This assumption, however, is profoundly incorrect. Begin with hydration. Muscle tissue is composed of 70 to 75% water, and every biochemical process within the muscle, including contraction, relaxation, and repair following exercise, occurs within an aqueous environment. Even mild dehydration, a mere 1 to 2% reduction in your body's fluid stores, can measurably diminish muscle elasticity, impede recovery, and increase the likelihood of cramping. Therefore, after concluding your walk, drinking a glass of water is not merely advice from a sports drink. Advertisement. It is a fundamental physiological requirement. Now, let us consider stretching. During the act of walking, your muscles operate in a state of repeated contraction, essentially shortening. Without subsequent stretching, these muscles remain in a slightly shortened state after you cease moving. Over time, this cumulative shortening can lead to muscles becoming tight and rigid, diminishing joint range of motion and fostering a persistent feeling of stiffness. This phenomenon is most commonly observed in the calves, the hamstrings, and the lower back. A mere 5 minutes of gentle stretching performed after each walk can entirely prevent this detrimental outcome. Finally, let us address the importance of rest days. Many individuals rationalize that if walking is beneficial, then more walking must be even better. However, this is not how the process of adaptation functions. Your body does not adapt during exercise. Rather, it adapts during recovery. It is during these periods of rest that muscle fibers reinforce themselves, joints remodel in response to the applied load, and the cardiovascular system restructures itself to better handle the new demands. If you consistently deny your body adequate recovery time, true adaptation will not occur. Incorporating 1 to 2 rest days per week is not an act of laziness. It is an essential component of the correct training protocol. It is crucial to conceptualize your walk not as an isolated event, but as an integral part of a comprehensive system. This system encompasses movement, hydration, stretching, and rest. Only when all these elements are integrated as a complete system can they produce durable, long-term health benefits. Here is a critical clinical observation that serves to unify all these points. The detrimental impact of each of these 7 mistakes carries varying degrees of risk, depending on an individual's age. The damage inflicted by poor posture, the use of worn-out footwear, and the neglect of post-walk recovery is demonstrably 2 to 3 times more serious after the age of 50 compared to when one is 30. This is because the inherent resilience of our joints, blood vessels, and muscles naturally diminishes over time. The same mistake that your body might have readily forgiven at 30 without any noticeable consequences will, at 55, almost certainly generate tangible symptoms. Reflect on your own age. Consider which age group this information resonates most closely with, as this will help tailor future content to address your specific needs and concerns. Now, for a clear, actionable conclusion, here is precisely what you should do after absorbing this information. Firstly, adopt the slow start rule. The initial 3 to 5 minutes of every walk should be dedicated to a slow pace without exception. This does not incur any additional time. You are simply commencing your activity at a gentler tempo. Secondly, check your posture at this very moment. Stand up, straighten your spine, gently lift your head upward as if being pulled by a thread, relax your shoulders, and ease them slightly backward. Hold this position and commit that feeling to memory, striving to reproduce it every single time you step out the door for a walk. Thirdly, pick up your walking shoes and examine the soles. If they exhibit uneven wear patterns, or if you have been consistently walking in them for more than a year, it is time for a replacement. This is one of the most straightforward yet highest return investments you can make in the long-term health of your joints. Fourthly, abandon the habit of relying on one long walk per week. The target should be 20 to 30 minutes of walking 5 to 6 days a week. If this appears daunting at present, begin with 3 days per week and gradually add an additional day every 2 weeks. This approach of gradual progression ensures sustainability. Fifthly, allow your arms to move freely. Bend your elbows, relax your shoulders, and permit your arms to swing in their natural rhythm. Remove them from your pockets. Sixthly, your phone should reside in your pocket for the entirety of your walk, with no exceptions. If you require audio, such as music or a podcast, utilize earbuds, but keep the screen out of your hands. Seventhly, after completing every walk, consume a glass of water and dedicate 5 minutes to gentle stretching. These 5 minutes are the bulwark protecting you from chronic muscle stiffness. Walking is undeniably one of the most accessible, safe, and remarkably effective tools available for maintaining your health, particularly after the age of 50. It requires no gym membership, no expensive equipment, and no specialized preparation. What it demands is the adoption of the right habits and a conscious, mindful approach. Implementing these small yet significant adjustments to how you walk will yield substantial, long-term benefits for your heart, your joints, your brain, and your overall sense of well-being. It is important to reiterate that no one in a typical clinical setting is likely to systematically guide you through these precise steps. This is simply not how that system operates, as it often profits from treating illness rather than preventing it. This channel exists precisely to bridge that gap. Subscribe to Dr. Watling, leave a like on this video, and help us collectively reach 100,000 subscribers, one informed and healthier individual at a time.